Hi, my name is Gavin Hall, and I guess many of you already know me. For those who don't, I have over 20 years' experience in the regulation of veterinary medicines. I was UK Veterinary Representative to the Commissioner's Notice to Applicants Working Group and UK Representative to the CMDV, a group I chaired between September 2014 and August 2017. We all know that the transition period comes to an end on the 31st of December this year, and I'm going to use this webinar to tell you a little of what the VMD will be like and what we will be offering concerning mainly the authorisation of veterinary medicinal products. I'll be mentioning a number of areas such as AMR, Northern Ireland Protocol, etc., but colleagues will be giving webinars on these issues which will explain those particular areas in more detail. I guess the starting point of this journey is Brexit. Whichever way you voted during the referendum, to leave or to remain, we have probably all had moments where we have had a head in our hands over the enormity of the task in preparing to leave the EU and for the UK to become a third country to the European Union. I know I have, and I know so have other VMD colleagues. In preparing the slide deck for this webinar, I wanted to include an inspirational quote. So after trawling through the internet, these two seem to fit. Albert Einstein said, "In the middle of every difficulty lies opportunity." And T.S. Eliot said, "I don't believe one grows older. I think that what happens early in life is at a certain age one stands still and stagnates." Well, Brexit and the Northern Ireland Protocol has certainly provided some difficulties, and the VMD and industry need to move forwards and not to dwell in what we once had. As with many people during lockdown, holidays soon became staycations. I recall looking through previous holiday photos with some envy when I saw this one. It was a sign at the start of a trailhead in the American Rockies. I remember taking this photo to record the high degree of difficulty of the hike, but its advice also seemed relevant as we approached the end of the transition period, and also during the Brexit journey itself. The sign says stay on the trail, and for us it can be read as don't get distracted, particularly as we're nearing the end of our journey. Next, pay attention to signs, or for us follow the guidance being issued. Keep an eye on our communications hub for the latest updates. It then warns that the trail is difficult, something true of most things Brexit. The sign tells us how long we can expect to be travelling and to allow plenty of time. Always good advice, and we'll be making sure you have time to make any changes that you need to make. It says groups should stay together. This is a journey we're all on, although some of us are moving at different speeds. We are advised to carry our own drinking water, or in other words, be prepared. Finally, there is a warning about unpredictable weather, and we have all had to quickly react to the implications of Brexit and the Northern Ireland Protocol as things become clearer. So with Albert Einstein and T.S. Eliot in mind, we need to move forward, and there is plenty of challenge in which to find opportunity. And so to the future. There will obviously need to be change, but there are also things that will stay the same. So what's not changing? We are still the regulator for the UK, including the regulator for Northern Ireland under the Northern Ireland Protocol. It is still our objective to have proportionate regulation. We are now a third country and have the right to regulate. We want legislation that provides assurances, flexibility and the appropriate legal reach. We want to reduce administrative burden, but we are a regulator of our now independent region. We are still a leader in the regulatory world of veterinary medicines. We regularly meet with the counterparts in the US FDA, the Veterinary Drugs Directorate in Canada, the Agricultural Chemicals and Veterinary Medicines in New Zealand, and with the Australian Pesticides and Veterinary Medicines Authority. We are still working to address antimicrobial resistance and have a global team taking forward a programme of work in Africa to help develop regulatory systems in order to improve the quality and availability of medicines in those regions. We still want to have safe and efficacious medicines available across the UK and to address availability. We want to retain the positive aspects outlined by our stakeholders over a number of years in various surveys. To be a leader, to be an authority that is listened to have proportionate, predictable and transparent processes, to have the available expertise. We are keeping the best bits and adding some extras. You'll recall the picture I included a few slides ago that provided instruction in following a particular trailhead. All very daunting from the outset, but once you get there the view is spectacular. It really was worth the effort. I guess now at the point in the trail, about half a mile from the end, the last of the water was drunk about an hour ago, and we're desperately looking around to see if a taxi or a chairlift turns up. People are coming down the other way, telling you not to give up and it will all be worth it. So here we are in the last leg towards the end of the transition period, and here I am telling you what you can expect when we get there. The headlines are that we will offer a greater flexibility to develop a GB regulatory framework, greater freedom to work with other regulatory jurisdictions, and a greater choice for applicants. And now we can look at more of the detail and advantages that a GB regulatory framework could offer. As previously mentioned, it is our intention to have proportionate regulation for GB. We'll be taking the best bits from the new EU Veterinary Regulation 2019/6 and adapting it to better suit Great Britain. Much of this regulation was negotiated and supported by the UK over a number of years during its development. It goes a long way, for example, in reducing administrative burdens. Nevertheless, we have already received suggestions from NOAA on areas where it might be beneficial to diverge from the EU framework. I'm not going to comment specifically on those suggestions or the timings of any GB legislation, but I will highlight a few examples we are considering which will make GB an attractive market. Even though Regulation 2019/6 is looking to increase data protection, the global market authorization concept is still in place. So the first time a company has a product authorized, that starts the period of data protection, and any subsequent developments have that data protection period backdated to the date of initial authorization. Here in Great Britain, we are considering decoupling species and pharmaceutical forms from the global market authorization, and thus they would attract their own periods of data protection. Another area of benefit links to Article 33 of Regulation 2019/6, which states that the assessment report drafted by the RMS in MRP and DCP must detail conditions that may be imposed regarding safe use and supply, including the prescriptions classification. In GB, when considering the distribution channel, we only need to satisfy GB and not to take into account the views of up to 27 member states and 3 EFTA countries. Looking at novel therapies, we can be more flexible around the definition and not be bound by wording that might be outdated within a few years. We will rely and use guidance, which then links back to having a proportionate regulatory framework. These are just a few examples taking the best bits of the EU regulation and adapting it to the benefit of Great Britain. Another significant opportunity is that we are now able to work more globally with other regulators. We know that we are operating in a global industry and that products are submitted in multiple regulatory jurisdictions. There is a desire between regulators to work together. For example, we have just signed off on a process for managing simultaneous submissions with the Veterinary Drugs Directorate in Canada. Guidance will be publicly available in the very near future. But in essence, Canada will lead on validation / screening, and the assessment timetables will follow the UK complex timelines. Canada will accept the EU dossier format with a crosswalk to the Canadian framework. There are assessor touchpoints built into the process, and you will receive the list of questions and decisions, etc. at the same time. Ideally, it would be good to harmonise labelling, but it's not a deal breaker if that's not possible. Each regulatory jurisdiction will take a sovereign decision to authorise. This allows you to have a single project team to coordinate submission and then to co-market across multiple jurisdictions. If you have a project that you think might be suitable for simultaneous submission in GB and Canada, then please get in touch. We also have monthly meetings involving the US FDA, New Zealand's ACVM, the Veterinary Drugs Directorate in Canada and the APVMA in Australia. Coordinator meeting time is problematic and usually results in VMD staff losing a little sleep. Although it's early days, we do discuss issues of common interest, and even now there is a desire for greater harmonisation, to share practices and to build upon each other's knowledge and expertise. There is also a desire to work together on assessments, and we are sharing our respective regulatory frameworks. Clearly there are barriers to overcome, but there is a will to work through these. The EU model first started with Directive 80/1851, which has seen at least one clarification and 2 previous legislative reviews, culminating in Regulation 2019/6, which comes into effect in January 2022. As you can see, a long journey, but we are just starting out. My personal view is it should be possible to have a global procedure where regulators of the USA, New Zealand, Australia, Canada, South Africa and the UK, for example, can work together on a global submission. As I say, we've just started out on this journey and the VMD will play a full part. Now looking at submissions for new marketing authorisations made after the 1st of January 2021. The headline message is that we're offering choice. Choice allows you as applicants to decide which route best suits your marketing strategy. You can submit your GB submissions in parallel with the EU applications. We can run them on the same timetable so that you get questions at the same time and a decision at the same time. You will need to keep us in the loop regarding EU questions and your responses in order to give us the best possible chance of facilitating common labels. Whilst that may not always be possible, it is an ambition that parallel submission supports. We have already heard about our assessment cooperation with Canada. That is just a start. We are able to manage co-assessments or simultaneous assessments with other regulatory jurisdictions. We know that products destined for submission under the centrally authorised procedure are often submitted globally across regions at different times. If you have such a project, why not think about co-submission and being able to launch the product simultaneously across regions? Talking of centralised applications, we can accept them at a GB level. If you don't want to run them in parallel with the EU, we can assess in GB and more likely assess in a faster time frame than the EU, given the key stages and assessment steps of the EU procedure. We can also accept co-submission of national-only applications made to cover NI and GB, effectively giving you UK-wide coverage. We can accept a single application form supported by a single data package, and we will assess together, and at the end of the procedure you will have authorisations that enable you to sell and supply your product across the whole of the United Kingdom. As you can see, we're offering a choice that best suits your needs. We can process applications on a national basis, or on an international basis, or with the EU in parallel, and thereby supporting joint labelling between NI and GB, or between NI, GB and the Republic of Ireland. Being a third country to the EU means that we can no longer use CESP or UDRA mail to submit dossiers or send information over a secure network. The EU systems are effectively off limits to us. However, we have developed our own. These at the very least replace the functionality of the EU systems and in many cases exceed what you had before, and further enhancements are coming. We know from feedback that the application form is much simpler and easier to complete, that the submissions portal and secure messaging services are equally simple and based on modern technologies. If you have not registered with us yet, now is the time to do so. Well, we are now at the end of this webinar. I have covered a number of areas within the slide deck, mostly at a superficial level. I'm sure you have questions and will want to dive into the detail a little more. So please make a note. There will be an opportunity to ask questions later. Alternatively, you could always send me an email. Thank you.
The VMD welcomes any questions that you might have. To ask your questions, please go to www.slido.com and use the event code 96607. Slido will be open for your questions until Friday the 20th of November. Responses will be published to your questions by Friday the 27th of November. If this presentation hasn't met your accessibility needs, please email director.support@vmd.gov.uk. Thank you.